Assalamualaikum warahmatullahi wabarakatuh. Welcome to the journey of Machmud 3S, an innovative audiovisual model that transforms clinical nursing education by integrating standardized documentation and brain-based learning. Introduce the team behind development of Machmud 3S audiovisual model. We are the creative 2002 team, Heriansyah, Mardiana, and me, Yulianto, present to advancing clinical learning through the Machmud 3S innovation. This innovation supports brain health education by reducing cognitive overload. It combines visual, auditory, and hands-on learning to help students better understand and apply complex clinical information. This innovation supports brain health in education by reducing cognitive overload. It combines visual, auditory, and hands-on learning to help students better understand and apply complex clinical information. Machmud 3S model was born out of a need to address disorganized nursing documentation, fragmented student handovers, and the lack of integration between learning and clinical practice. Machmud 3S is presented as a multimedia model combining clinical case simulation, documentation, training, and interactive format aligned with SDKI, SLKI, and SIKI standards. Model is part of a broader system that includes 149 nursing diagnoses and hundreds of implementation guides. It prepares students to document care comprehensively and consistently across shifts. The model was developed through a structured research and development process, resulting in empirical findings and scholarly publication that validate its feasibility and innovation. Unlike conventional nursing documentation models that often rely on narrative notes or inconsistent checklists, the Machmud 3S model introduced a structured, shift-based and collaborative documentation system aligned with Indonesian national nursing standards. Its clinical action is mapped into standardized diagnosis, outcomes, and intervention, then supported by guided implementation format and to ensure clarity and continuity of care. This model allows 3 nursing students to document care for one patient using unified clinical reasoning. It's not only standardized care, but also trains students to critically evaluate their nursing action in real time, promoting accountability and reflective practice. Machmud 3S is not merely an instructional tool, but a comprehensive academic innovation that operationalizes the 3 Dharma values within nursing higher education. It bridges academic theory and clinical reality, fostering transformative impact across educational, scientific, and social domain. The vital science sheets allow continuous monitoring, while the implementation form used a structured format based on SIKI, recorded hour by hour. This design mimics real medical records and support clinical reasoning. The format shows how the format is filled efficiently, visualizing care progress, reducing redundancy, and enabling easier analysis during care seminar. This approach fosters teamwork, accountability, and standardization in nursing education. This section presents the core innovation of Machmud 3S model. Its unique documentation format that distinguishes from conventional nursing care models. The implementation format for nursing action based on the SIKI taxonomy, covering observation, therapeutic education, and collaborative intervention. What makes this format unique is the seamless integration of 24 hours data input using a timeline interface that mimics an actual medical records. Compared to conventional methods, this documentation is more efficient, less repetitive, and enhances visibility of the patient clinical progress. It creates a visual narrative or care over time, allowing both educator and student to easily identify trends, evaluate interventions, and conduct case seminar using real-time data spanning multiple shifts. The 24-hour vital signs observation sheet allows continuous patient monitoring across 3 shifts, where each student in a team contributes their finding and intervention based on clinical data within a assigned time frame. This integrated format also promotes collaborative learning by ensuring 3 students manage a single patient together, fostering continuity of care and peer-driven accountability. Such a system is rarely found in standard clinical education approach, making Machmud 3S is adaptive and future-oriented model for standardized nursing documentation. Join us in shaping the future of nursing education through Machmud 3S, clinically relevant, academically grounded, and professional transformative.